Thank you, Honorable Chairperson. Honorable Chairperson, the Presidential Health Summit that was held this past Thursday and Friday in Israel were nothing more than an ANC Congress in preparation for the 2024 elections. This whole summit were nothing more than a talent listen process, and it was not a consultation process. I have attended the summit online for the reason that all opposition parties in the Portfolio Committee on Health could attend the summit in person. All the presentations that were presented during the summit was done by government and the African Union and some other institutions. It might as well have been done in a normal Portfolio Committee meeting. All stakeholders in the medical industry, private and public, as well as all political parties represented in Parliament, should have been afforded the opportunity to make an input about the problems in the health sector and to present solutions to these problems that are threatening the lives of our people on a daily basis in the public health sector. Then you can call it a health summit. This was nothing more than an ANC talk show. Every year, annual performance plans from the department and its entities are presented to the Health Committee. And every year we ask the same questions but never receive adequate answers on the problems that is threatening the lives of patients in public hospitals. We are currently sitting with a decreased budget of 64.6 billion from 22-23 to 62.1 billion for 23-24. Service delivery in our public sector is currently non-existing. Patients complaining daily from inside hospitals, but they are lying there for weeks and months awaiting surgeries just to find it cancelled day after day for reasons that is either the unavailability of beds, medicines, doctors, or the aircons that have broken down in the theatres. Patients on the outside is also complaining of hospitals that cannot admit them to perform urgent medical procedures or treatment. Not a day goes by without receiving these types of complaints, and we are receiving them on a daily basis in huge numbers. The Eastern Cape currently suffers a huge shortage of chronic medicine across the province due to the non-payment of manufacturers. The backlog in medical procedures are worsening by the day. The Financial and Fiscal Commission reported to the committee, but compared to other countries, South Africa has the lowest number of doctors per 1,000 patients, as well as the highest number of patients per doctor. The situation is worsening as South Africa had a 0.79 doctors per 1,000 patients in 2019 and it decreased to 0.32 in 2022. The huge diesel bill of 685 million for the past financial year to keep the lights on in the hospitals is a huge worry. With a plan to install solar panel systems at clinics, it also is not clear in how the system will be funded and the security measures implemented to see to it that these panels or its components will not be stolen or vandalized. The fact that more than 178,000 children died in our state hospitals in the last decade is also a huge concern. Every year, we must hear in the committee that new public health facilities are being constructed or current facilities being revitalized, but we never see a report on these matters either from this department or the Department of Public Works. But regarding the draft, regarding the medical legal claims, it's still not clear what this bill will entail and if it will address the problem. In fact, but there is also a shortage of executive heads at provincial hospitals, especially in 6 of these institutions in Gauteng, can be seen as one of the reasons for poor service delivery at these facilities. The ANC must take note not to launch a witch hunt on private health facilities regarding the inspection of these facilities, but should rather close down facilities like Dora and Ginza, but is not fit for human use or medical treatment. When there is an amount of 1.5 million dedicated to the National Health Insurance, even with the uncertainty of what this model will cost for taxpayer and no finance model yet. Ek hoop van harte dat die agbare minister aan ons 'n werkbare en uitvoerende plan van aksie gaan voorlê om die openbare gesondheidssektor wat reeds afgesterf het te laat herlewe, sodat Suid-Afrikaners weer gesondheidsdienste van hoogstaande gehalte sal kan ontvang. En nee, die nasionale gesondheidsversekering is nie 'n plan nie, dit is 'n ANC nasionaliseringsaksie. Ons soek vandag oplossings en uitvoerbare planne, want Suid-Afrikaners sterf daagliks weens die regering se onvermoë om gesondheidsdienste te lewer. Ons kinders, gesonde mense en ons bejaardes sterf in hierdie geriewe op 'n daaglikse basis weens hierdie regering se nalatigheid en slapheid, en Suid-Afrikaners soek oplossings en hulle soek dit nou. The citizens of this country are fed up with this government. The citizens of this country will no longer pay the price for this government's incompetence, maladministration, and mismanagement. The citizens of this country will be sending the ANC home. Your time is up. President Nelson Mandela would surely have been deeply disappointed in your actions and the manner in how you treat South Africans in our state facilities. But ANC must go home. Thank you, Chairperson.